Question number 4, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by his statement that the New Zealand mental health system is, quote, high quality, end quote?
Speaker.
The Honourable Dr Jonathan Coleman.
Yes, but we have to continue progress in increasing access to services. It's clear that demand is rising, and this is in line with international trends. Responding to this and staying ahead is a key priority for the government, and that's why we've increased total mental health spending by $300 million, and we're seeing and treating 28,000 or 20% more people per year than 5 years ago. The main reason I'm confident that our services are of high quality is the 9,500 doctors, nurses, allied health and other support workers delivering mental health services in our district health boards and NGOs. They're doing a terrific and very difficult job.
Supplementary question, Mr Speaker.
A supplementary question, the Honourable Annette.
Is it a high-quality system when a recent review of mental health services at Capital and Coast, Wairarapa and Hutt Valley DHBs highlighted, quote, chilling missteps with tragic failure of technology leading to 1 of 5 murders in 15 months involving acutely unwell mental health patients?
The Honourable Dr Jonathan Coleman.
Mr Speaker, there was an independent review of mental health services in the region following that group of suicides, and what it concluded, amongst its 8 recommendations, the major one was that we need to develop a single medical record for mental health clients, and the Director of Mental Health is accepting that recommendation and acting on it.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Is there high-quality resourcing for mental health patients when 19 staff in the Community Mental Health Service team at Capital and Coast DHB are trying to manage 400 to 500 mental health referrals a month in the Wellington region alone?
The Honourable Dr Jonathan Coleman.
Mr Speaker, when you're talking about resourcing at Capital and Coast, that's gone up considerably. It's gone up by 22% over the last 8 years, from $80 million per year to $98 million. Now, it'd be interesting to know the detail of what the member is alleging there, but what I can say is there's more money going in and more people are being seen, and they're being seen more quickly than ever. But there's no question there is more to do.
Point of order, Mr Speaker.
Point of order, the Honourable Annette.
To assist the Minister, I seek leave to table the review of the care and treatment provided to 5 people who attended the mental health services, health, addiction and intellectual disability services at Capital and Coast Mental Health, where they raised the issue.
We don't need the qualification. Is the report freely available on the internet?
Well, if people can find it, yes, it is. But it is a review report. The Minister hasn't seen it.
No. If it's freely available and the members acknowledging it is, then members can source it themselves if they want it. Supplementary question, the Honourable Annette King.
If mental health resourcing is adequate, why have mental health staff written an open letter to him pleading for help to fix, quote, a broken system that is in crisis, end quote, and will he now concede that mental health is underfunded and needs an urgent review?
The Honourable Dr Jonathan Coleman.
Well, of course, the member's referring to those strong supporters of national government, the PSA, who wrote that open letter. What they do know is that mental health funding has gone up from $1.1 billion per year to $1.4 billion per year, a rise of $300 million. But on top of that, we're actually treating, listen to this, an extra 28,000 people per year, a 20% uplift in the numbers of patients. So we're doing more, we're putting more in, but of course there is always more to do, and we'll continue to do that.
Supplementary
question, the Honourable Annette.
If the government's providing enough resources for a high-quality system, why was National MP Nicky Wagner forced to apologise for the state of mental health facilities at Princess Margaret Hospital and the people of Canterbury told, quote, we either continue to use substandard facilities or we stop delivering services, end quote?
The Honourable Dr Jonathan
Well, of course,
Coleman.
as the member will be aware, there's a $1 billion capital investment program going into health services in Canterbury. On top of that, the operational funding has increased by 25% over 8 years, and we are determined that we are going to continue to provide very high-quality services in mental health in Canterbury. That's why we had that $20 million package last year, and that's why, of course, we're partnering with Christchurch Council and we'll be down there on Friday announcing that $1 million contribution from the government to partner with Christchurch City Council to continue to provide the services that are needed. The problem, though, for the Labor opposition is that they think the measure of success is just purely about the dollars. They should focus on the results. They might do a bit better. That's your problem.
Order. Order.